Why do some women prefer not to get an epidural? You don't get an award for rejecting an epidural, so why even bother? It's a fair question, and today we're going to explain why more and more women are choosing to go unmedicated. And if you're pregnant and are trying to decide whether or not you want to get an epidural, then stick around because we'll go over everything you need to consider. Hi, I'm Rachel Moises from the Mighty Mama Movement.
And I'm Heather Shelley, family nurse practitioner and midwife.
So, statistically speaking, most women get an epidural. Most women who give birth vaginally in US hospitals, at least. The statistics are pretty different depending what country you're in. But in the United States, about 71% of women who give birth in a hospital get an epidural. Okay, so choosing to get one is pretty common. To begin, I want to share just briefly why I chose to go unmedicated with my births, and then we'll have Heather share her experience with you. We just want to make sure that you have different perspectives, and then we're going to dive into some facts and really important information that you need to know. So for me, back when I was pregnant with my first baby, I wasn't actually really into natural things. I am a lot more now, but I wasn't then. I hadn't learned or even given it much thought. But as I did some research and tried to decide, should I get an epidural or not, I learned that there are some risks involved with getting an epidural, potentially for the baby. I understood that those risks were really quite low and probably were not going to happen to me. But I just felt that I would rather do it unmedicated than take those risks. I wasn't a super strong conviction, and honestly, I can't say why that labor was really horrible. I went in to be induced on Thursday morning and I didn't give birth till Sunday evening. So it was a very long labor. And looking back, I would say, honestly, I probably should have just gotten the epidural because I was uneducated about natural birth. I didn't know what I was doing. And so it was a really bad experience that, frankly, I think an epidural would have just saved me a lot of trauma. And I'm not necessarily saying good thing I didn't get the epidural. Later on, when I learned all about natural birth, I got to a point where I didn't even consider an epidural because I didn't need one. I knew how to give birth with low pain without one, and I understood more about the risks and all of that. But looking back to the first one, maybe I should have just gotten one. So that's kind of my story with epidurals. How about you, Heather?
With my first baby, I would ask all my friends, tell me about childbirth. And I'm dating myself a little here. There wasn't the internet like there is now, okay? So I would ask all of my, college roommates and high school friends from years past, tell me about childbirth. Tell me what to expect. And they all just said, just get the epidural. And I was like, okay, but tell me about childbirth. And they were like, oh, just get the epidural. Like, that's all you need to
You don't need to learn anything.
Yeah. So I didn't take classes because they were taught on evenings and weekends, and I worked evenings and weekends. And so I got the epidural with my first baby, and it worked for a few hours, and then it stopped working. And they tried to redo it. It still didn't work. So my second baby, I was like, I'd really like an epidural that works, because even if the epidural doesn't do pain relief, you're still trapped to the bed, you're strapped to the bed. Like, they treat you as if you have an epidural, even though you're in pain. Oh. And so my second baby, I was progressing extremely fast, didn't realize how fast I was progressing. And so I asked for the epidural, and the moment they were done giving me the epidural, I was like, I have to push. So they never even connected it to the pump. They gave that little test dose, and then they didn't connect it, and I had my baby. So by this point, I was like, I'm done with epidurals.
They're not working out for me.
Right. They're not doing me any good. And so my third and fourth baby, I went unmedicated, kind of like you. It's not that I was on a kind of a natural thing. It's because I wanted the freedom to move around. And I'm like, epidurals don't work on me. And I found out that 10% of women, they don't fully work. They may work on your left side, but not your right side, or you'll have what they call a hot pocket. And you think, oh, well, who cares that this little section on my leg isn't numb? Except for all the pain receptors go to that spot. And I just thought, you know what? I can handle childbirth a lot better if I can walk and get in the water and eat and drink. And without having the restrictions of the epidural, I could do all those things. And so I just said, I'm not getting the epidural because I want to be able to have the freedom to move around and go to the bathroom on my own and not have a catheter and stuff. And that was the best decision. But that's why I did it, because one, they didn't work. But rather than give it a third try, I was like, I can do this on my own. I just need to be not strapped to a bed.
And that's definitely true for anyone who does want to go unmedicated. Education is really important, knowing what you're doing. Like
Definitely.
My first go arounds where I was doing it unmedicated, but my only education was some research on the internet. And so I really wasn't educated. So I was not able to have a positive natural birth. Later on, when I learned everything that we teach at the Mighty Mom Movement, then I was able to have really positive, great natural births. And I didn't spend the whole time wondering, why in the heck am I doing this without an epidural anyway? And sort of, I mean, honestly, in my first couple of births, there were a lot of moments where I thought a C-section sounds great.
Right, just
cut me open and get the baby out. That's all I want, you know. And in that moment, you're not worried about the recovery and the long-term consequences and all that. It's like, just get it out. So that's the point. You're doing a good job. You're getting educated. We're not going to tell you if you should get an epidural or not get an epidural, but whatever choice you make sure that it's an informed and educated one. And then if you do decide to go for an epidural, embrace the experience fully and learn how to do it. Okay, so let's dive into some of the common reasons why women out there decide to not do an epidural. Heather and I have mentioned our reasons, but let's go through them in a little more systematic way here. So what would you say are the most common reasons why women do say, I don't want to get an epidural?
I think it's because they don't want the side effects for them and for baby, for the epidural. That's the number one reason that I hear from women, is they don't want the side effects for baby, which can cause difficulty with breastfeeding and kind of a more sleepy baby that way.
So when the baby's born, they're a little bit sluggish, you could say.
Right. And then for moms, there are so many side effects that can happen. For instance, you have to be given a liter of IV fluid before they'll give an epidural, because epidurals typically lower your blood pressure. And lowering your blood pressure, if it gets to very low levels, that means you can't pump blood effectively to baby. And so baby's heart rate will go down. And so you can have the low blood pressure, which means baby gets a low heart rate, and that is not something that you want.
Right.
Itching on some people. For me, the 2 epidurals I got, I had a fever each time. And why that is, I guess you could say, dangerous, is because they're saying, did you get the fever from the epidural, or is there an infection we don't know about? And if it's just from the epidural, they're basically going to leave you alone. But if it is from a fever, from an infection, that can be dangerous. Can be dangerous for mom and dangerous for baby, but they don't know which one it is. And so then you go on these protocols where they're like, do we do antibiotics? You know, all these different things to do. Is mom sick? Should we separate her from baby? What's going on? And it's kind of this snowball effect. And so I didn't want that to happen again, where the nurses were always panicking. Why does she have a fever? Why does she have a fever? And I was like, because I get a fever every time. Like, come on, guys. But they have to.
They have to take the precautions.
Right.
Yeah.
Some women get intense itching with it, and they just will scratch themselves.
Like in the insertion side, or just anywhere?
Just anywhere.
Oh, okay.
Yep, just anywhere. It's usually kind of almost like an allergic reaction to some of the medication.
And that's while they're in labor, or does it go away once epidural's out?
It can persist for a little while. Yeah, okay. A little while afterwards, but it drives moms crazy. So then they have to be given Benadryl.
And you're in labor.
Yeah, and Benadryl makes you tired. Exactly. For most women, it's a longer pushing phase, because so many women will say, I couldn't really feel where to push. I couldn't really tell, because as baby comes down the birth canal, they hit the same nerves that when you're going to have a bowel movement that would hit. And so it's this overwhelming feeling that we're very used to in the bathroom kind of thing. But when you have a strong epidural, and even, mild epidurals, you can't always feel where to push. And so moms are really pushing and pushing and pushing, and not much is happening because they're pushing up here rather than in their pelvis kind of thing. And so that can cause a longer pushing.
So I want to share a story. I have permission to share this story from a woman in the Mighty Mama movement. Her first birth, she got an epidural, and this was before she had met the Mighty Mama movement, and she had 5 hours of pushing. Ooh. So now she did have an epidural, so she wasn't necessarily in the intense pain the whole time, but it's extremely uncomfortable. The positions they have you pushing in. Right. You can just imagine the trauma to her perineal area after 5 hours of pushing in all of her abdominal muscles. I mean, it's just, I just can't even imagine 5 hours of pushing. And so then with her second baby, she had found the Mighty Mom movement and used the practically pain-free birth method. And she was getting to the pushing phase and she started to get scared. You know, what if I can't do this? And just all of those natural thoughts from after a previous traumatic experience with pushing. But she was able to get her baby out in 10 minutes.
Wow.
And that's because she didn't have those limitations and she was just able to do it naturally. Now there's other factors because we teach a lot of things that can help pushing go better, but I think the absence of the epidural for her was actually beneficial and made her whole experience much more positive.
Right. Well, and getting an epidural in many cases increases the need for Pitocin because the uterus slows down in contractions because the epidural interferes with the function of the uterus. Mm-hmm. And then moms who are not able to push effectively may need a vacuum or forceps delivery. Mm-hmm. And so that can be common. Now, I want to talk about some of the positive side effects in some women. If I have a mama who is very tense, very just cannot relax, is stressing out with every contraction, tensing her body, and kind of doing the opposite she should do. And sometimes that's because of past physical or mental traumas. Maybe they are being traumatized in the moment. They have a nurse or a provider that is fighting against them and they can't relax. Mm-hmm. An epidural in those rare circumstances can actually relax the mom enough that she can finally let go and let the body do what it's supposed to. Because if we fight our body, as you know, you can't fight labor. You just have to let it happen. And for the women who are fighting it, that can really help let everything go. She starts to dilate and it can make a big difference.
Okay, so I'll share a little story of my own. With my second birth, so I count my second birth as being unmedicated, but I was like you that I got an epidural and then pushed the baby out before the anesthesia. So I just was done cleaning up his little instruments there. So it never did me any good as far as pain relief. However, it did make my birth much, much better because this is what happened. I went in to be induced in the morning. This was my second birth. I had all these positive mental vibes. It's going to be way better than my first one. And I still wasn't educated beyond the few things I learned on the internet, but I knew I was supposed to relax.
Right.
And I was doing a pretty good job at that and things were going fine. And 10 hours into my labor, they checked me and I was only 3 centimeters dilated. And I'd been on Pitocin the whole day. And I couldn't take it because of my previous birth experience that had drawn on for so long. And I had thought this was going to be so much better and so much faster. And 3 centimeters after 10 hours. So how much more time am I going to be in labor? And I couldn't take it. So I had kind of an emotional breakdown. And so I said, I want an epidural. Like I just had this image in my mind of my sister-in-law who had given birth a couple months before with an epidural, and they'd shared a video in labor, except she's just hanging around. And I was like, I'm doing that. Give me the epidural. So from that moment on, where I decided to get the epidural, and they had a doctor talk to me about it first to make sure I was, they explained to me some risks, and they said, no, I want it. But it's going to take the anesthesiologist a half hour to get here. Okay. My body relaxed so much. It was like, I remember being a kid and crying for a long time if I was really upset about something. And then when you finish crying and your body just feels like this really deep relaxation because all that tension is over and you got it all out. And I felt like that. I felt so, so, so relaxed. And so I went from that 3 centimeters dilated to my baby flying out. I mean, the doctor barely got there and all my water came out at the same just in that half hour period of time because I had relaxed so much. Now, one thing I will say is that, again, I'm going to talk a lot about education in this one, because if you learn the deep relaxation technique like that we teach it in our free birth class, you don't even have to do like any complete to learn that. You don't necessarily have to rely on an epidural to help you relax. Like I learned later how to do that and get that deep state of relaxation without the epidural.
Right.
But
And that's where the childbirth classes like that we teach come into effect, because mine was very similar to yours. I had a long first labor, not as long as yours, but very long Pitocin, quite miserable labor. So my second baby, I was just kind of having piddly labor. And so my doctor's like, hey, what do you think about breaking your water? I was like, will it make the baby come faster? He's like, most likely, yes.
mm-hmm.
And so I was like, all right, I'm getting tired. Let's break my water. So he broke the water and he left to go to choir practice, actually.
Okay.
And within 15 minutes, I went into hard labor. And the nurse checked me, and I think I was like 4 centimeters. And I was like, I can't do this for 6 more hours, because they say, oh, you dilate a centimeter an hour. And I was like, I can't do this for 6 hours. There is no way I can do back-to-back, no breaks in between my contractions for 6 hours. And so I was like, okay, get me the epidural. And they called the doctor. They ordered the epidural, which usually takes a good half hour for them to be able to get into your room and do it. So by the time the doctor, the anesthesiologist got in there, and then they called the doctor, the nurse checked me because I was like, I have to push. And she was like, you're complete. So I went from breaking my water, piddle paddle labor, nothing serious, to birth in 2 hours.
Mm-hmm.
And like you, they didn't, like I said, they didn't even hook it up. And where I look at that is, had I looked at the signs and said, hey, because every labor isn't the same, I skipped active labor and went from prodromal labor to transition.
Mm-hmm.
And so with my third baby, I was in a birth center, so no epidural. But that same thing happened, is I went from prodromal labor, and within 2 or 3 contractions, I went into transition.
Mm-hmm.
And I thought, I can do anything for 2 hours. For 2 hours, I can do anything. And if I would have, hindsight's 2020, right? If I would have known, oh, I only had 2 hours, I'd have just stuck it out.
Yeah.
But like you, I thought, I can't do this for 6 more hours. There is no way.
Yeah.
And so with my next baby, I was like, I can do it.
And that's the difference that knowing how to handle labor properly makes. Because then, I mean, like I said, I did get to a point after I learned, everything that we teach here on this channel and at the Mighty Mama movement, where I didn't have to be thinking, maybe I should get the epidural, maybe I should get the epidural. Like, it just didn't ever come to my mind. It was like, no, I know how to handle this. I know what to do. I can get through this. So that was some positive side effects of it. Or are there any other positive side effects of the epidural we need to go over?
I think a lot of it is mental for the women who just, they can't relax. They weren't taught how, or because of past traumas, they just can't get out of their head and let their body do its thing. Then it can be a positive thing for them.
Okay, so now let's kind of switch back to some of the potential negative side effects of epidural. So we've already kind of touched on this, but can you talk to us about an increased risk of interventions? You mentioned vacuum forceps and whatnot, but explain to us how that works.
So typically you'll have a longer labor. C-section rate does go up a bit. I don't know what the current statistics were. Honestly, the last time I looked, it was quite a long time ago, but you did have a higher rate of a C-section. Now, part of that is when you have an epidural, you are in bed. And the most that you can do is typically roll a little bit to your left or a little bit to your right. And that can cause a posterior baby. A posterior baby, because of the head circumference and the way it comes out, is a larger diameter to push out, which increases your chances of a C-section. So that's one of the reasons. And then, of course, because moms, if they can't push effectively, that can also help it. And then the other thing is that with mom not being able to move much, it's like getting a baby out is like a ring, right? So we don't just, well, unless it's too big for your finger, we don't just pull a ring off. We kind of have to work it off. And that's, and the baby and mom is they do this dance to help baby get through the pelvis. And with the epidural, mom's just on her left or on her right. So she's not moving, she's not lunging, she's not wiggling her hips because her bum is in the bed. And so baby has to try to navigate out on its own without that additional help from mom moving her hips.
And with mom's pelvis being in an unideal position to begin with, right?
Exactly.
So We talked just a little bit about the ingredients in the epidural. I know
Yes.
I've heard rumors that they can have fentanyl and things like
They-
that, that some women
Yeah.
just say that's a deal breaker for me. I'm not going to do it because of that.
Right. So it depends on the anesthesiologist. They each have their own kind of cocktail. I worked at a hospital in Washington that the lactation clinic could tell which babies or which moms had had the epidural. But to take it a next step level, what they found is the nurses could tell who the anesthesiologist was on call by how the baby breastfed.
Oh, really?
That's because they knew the cocktails of the anesthesiologist. And some anesthesiologists had stronger cocktails than others. And so it can have opioids, fentanyl, a lot of heavy narcotics are in there. And so it doesn't get to your brain, so it doesn't make you loopy like a shot of Stadol or a shot of fentanyl or anything like that would, but it does get to baby and it affects baby. So like I said, not as intense for the mental part of it and the respiration for mom and baby, but it definitely affects babies breastfeeding. And that was an interesting study that they were doing to say, we can tell who the anesthesiologist was on call by the way the baby breastfeeds.
Okay, I did not realize that I thought an epidural was an epidural. I didn't know that the anesthesiologist is sort of handpicking exactly what's in it and the amounts that are in it.
Yep.
Okay, so is it an option for women to say, hey, I want like a much more mild epidural, or is there even any point to doing that?
Yeah, so real quick, there's a difference between a spinal and an epidural. So typically, if you don't have an epidural and you're going to a C-section, they will just do a spinal, which is a little deeper than an epidural. And so a spinal will kick in much stronger, where you are very numb from the waist down so that you don't feel surgery.
Right.
And if you have an epidural, they're just going to give you a higher dose of medication. So you get an even more potent combination or cocktail so that they can really numb you. And this does really quickly, made me think of one of the other side effects, is that if the epidural is placed just a little too high, you will feel like you can't breathe because you can't feel yourself breathing. So I've had many women that, when I was a doula, that I remember when they would have a C-section, so they would up the strength of the epidural or they would give them a spinal for this. And they would be on the table, the surgery table, and they would say, I can't breathe. I can't breathe. And so the anesthesiologist would, put the pulse oximeter on their finger, and he would say, okay, your pulse ox is fine. Oxygen is happening. You just need to try to relax. But of course, when you feel like you can't breathe, you're going to panic.
Done.
Right. And so that can happen with some women, is they feel like I can't breathe, and that causes a lot of panicking. I just thought of a couple more side effects with it, if that's okay.
We want to hear them all. That's why we're here.
One is a spinal headache. So what happens is when they go in for the spinal or for the epidural, they're going through and they're getting it in your spinal fluid. And sometimes if they get it kind of in the wrong place, when they take it out, you will leak spinal fluid. And it's very little, but that spinal fluid can cause a massive headache that you can't get rid of. The only way to get rid of it is to do a blood patch, and so that you stop leaking spinal fluid. And moms will be flat in bed, like literally flat. They cannot sit up without their head feeling like it's going to explode. And it usually, unfortunately, takes a few days for them to realize.
The first few days of your baby's life.
Right.
And you're also just recovering in general from all of birth. That's
before they go,
so sad.
I wonder if this is a spinal headache, a spinal fluid problem. And then they'll go through, they'll test it, they find out it is. Then the anesthesiologist has to come back in. They have to do this procedure.
Oh, what a bummer.
And you've missed, usually the first few days of your baby's life. So that is one of the side effects. And then another one is they typically put, with an epidural, they have you put your knees to your ears, and kind of push,
like we see in the movies, just that
exactly
standard.
And then what happens is everyone is so excited that they're holding your legs, and they forget to put your legs down in between contractions. And so let's say you're pushing for 2 hours, which is pretty common with an epidural,
Mm-hmm.
your legs are held up and it will pinch the nerves on the hips right there with the legs. And I had one woman that came to me and she said, I absolutely under no circumstances want an epidural. And it wasn't because she wanted to go natural. It's because she was not able to walk for 3 months after she had her baby because those nerves were so pinched that it took 3 months for them to heal. And she had to go through physical therapy to be able to walk again.
The Mighty Mom Movement, we're an online birth education program. So we hear from a lot of women from all over. And we always get comments from women on our, social media posts and everything that are kind of like, there's nothing wrong with getting an epidural. Like it's stop. They accuse us of kind of scaring people or whatnot, which we don't. We're supportive of people who want to get it. We don't have a problem with that. We're just all about informed choices and supporting women who want one and women who don't want one. Right. But anyway, people like to make those comments. It's pretty common. And I cannot tell you, the number of other women who have responded to those comments and said, well, I had my baby X number of years ago and I still have chronic back pain because of my epidural. And yeah, but that's a really small percentage. It almost never, it's very rare. It hardly ever happens. Okay, but it happened to me. And now for the last 8 years, I have chronic back pain. This type of conversation happens all the time. And so I'm not saying that to scare you. It's just that was definitely for me in the back of my mind when I was deciding an epidural or not. Like I realized that these types of things do statistically happen to a small percentage of people. Right. But what if I'm the one that it happens to? It's me, it's my body, it's my life. Like then I'm going to care. I'm not going to be like, well, it's only 0.2% or whatever the statistic is. That doesn't matter to the women who do have these complications and these problems. You know what I mean?
I remember talking to the anesthesiologist after my first baby. And I was telling him how it didn't work and he was ignoring me. He actually had to give me a formal apology. I demanded a formal apology just because he was the way he treated me. And he said, well, 10% of epidurals don't work. And I said, then you should have told me that before giving me the epidural. Mm-hmm. And that's what Rachel and I are trying to do is we're not trying to convince you to do one way or convince you to do another. What we are about is absolute informed consent. Because if you go into it knowing that 10% of epidurals don't work, they work on the left, they work on the right, they don't work at all, they have a hot spot, whatever the situation is, then if that happens to you, you're like, oh, well, that sucks, but I knew that could happen.
I knew it was a risk.
Right. Yeah. Rather than going, what is going on? I thought epidurals 100% worked. Or, something happening to baby, you having a really difficult time breastfeeding. And then the lactation consultant said, well, this can cause a problem. And you're like, I wouldn't have gotten this if I would have known. I thought these were benign. And that's the thing is so many people treat an epidural because they're so common in the US like they are benign, and they're not benign. But once again, there is a time and a place for them. When I have a mom who has been in labor for 36 hours, she started labor at 10 o'clock at night on Friday. She's gone all the way. And now it's hitting Saturday night. And she just says, I can't do this. I am exhausted. I am tired. I have got to sleep. I understand when she wants an epidural because I always say fatigue is the biggest enemy of natural childbirth because it's hard to go through something and walk the halls and get in positions when you're thinking, all I want to do is lay down and sleep. I'm so tired.
Yeah, it is. It's mentally and physically exhausting and challenging. You need to be in that space. And I just want to add to, because this is something you'll hear me say this a lot, but because about 10% of epidurals fail, I always encourage women that even if you're for sure want an epidural and you're like, I'm not even questioning it, you should still learn how to give birth without one in case yours fails or in case you don't make it to the hospital in time or there's some other thing that prevents you from actually being able to get the full benefit of the epidural, because that's a horrible situation for a woman who was counting on it.
Right.
And like with your first birth and there was like, just get the epidural, don't learn anything, you don't need to know anything. And then you had not the best birth experience because you didn't know what to do when it didn't work.
Right.
So you're getting educated right now. Good job, but keep it up because there's a lot more that you need to learn.
So let me give a quick example about that. I have known at least 2 women that were scheduled for C-sections and they went into labor spontaneously. One went into labor in the middle of the night and the doctor refused to come in and tell her C-section what time. The
Oh,
scheduled
it was like
time.
the night before her
Right.
C-section.
And she wasn't progressing quickly. And so he was like, I'm not coming in the middle of the night to do the C-section. She can wait.
You can just stay in labor even
Right.
though you were going to.
But here's the thing. He didn't want her to get an epidural. He wanted her to get a spinal.
Mm-hmm.
So he wouldn't order the epidural until it was time for her C-section.
Oh.
And so the nurse was livid. I remember seeing her march down the hall, just mad as could be, going over his head. And this mom had to deal with natural childbirth, even though she was scheduled for a C-section. Another mom at a very small hospital, same thing. She went into labor. It wasn't middle of the night. It was during the day, but before her scheduled C-section. And the doctor was fishing. And this hospital only has 3 doctors, and you have to have 2 doctors to do a C-section. So he was fishing, and he did not want her to get the epidural until he was within an hour of being able to start the C-section. Mm-hmm. So he had to get off his fishing trip, come in, that whole thing. And none of the nurses at this little tiny hospital were trained in natural childbirth. They they did a few a year was all. And so even though I wasn't in that department because it was such a tiny hospital, I said, hey, I'm going to go over there. And they were like, great. And I taught the dad how to do some of the things we talk about in the Mighty Mama movement. And when I came in the next day for my shift, they were like, thank you so much for teaching her husband these things, these pressure points and stuff to do, because she had to be in labor for 2 hours before she could get her C-section.
Yeah.
And so it goes along with what you've said, or the anesthesiologist is in another C-section or just in a general GYN surgery.
Yeah.
And he's like, this isn't an emergency. I can get to it in 2 hours. Well, you have to deal with labor for 2 hours. Mm-hmm. So learning these things is very advantageous, because otherwise you're just screaming, laying in the bed, not realizing that if you got out of the bed and you moved and you did these things that we talk about, how much easier birth would be.
Okay, we have a few more reasons why women often get don't get the epidural. So I want to kind of finish up with that list. And one of them was fear of needles.
Yes.
So for a lot of women, that is a legitimate thing where they just say, I don't care about natural stuff. I'm not a crunchy person, but I can't handle the idea of getting, I'm more afraid of the needle than I am of natural childbirth.
My second baby, I was like that. I went back and forth, back and forth, back and forth, back and forth. Yeah.
So if that's your situation, it's valid. There are a lot of women who have that feeling. So there's a reason to consider going unmedicated and learn how to do it. And then you talked about, not being able to push well and all of that. And then part of it is women want to feel more involved in their birth. It's not just that they want more effective pushing and to avoid interventions and all that, which is really good reason, but they just want to feel like they were involved in actively giving birth, in sort of like something was just happening to their body and they didn't know what was going on. And I'm not saying all women care about that. A lot of women are like, I don't care. Give me the epidural. I don't care if I feel it. I don't want to feel it. That's the whole point. But there are others who say, no, I'd like to feel like I sort of actively gave birth instead of just was this passive participant in birthing my child. Right.
Definitely. There are many women that they want to feel like they gave birth, not the doctor pulled the baby out kind of thing. They want to feel that experience. And I think look at a marathon. We talk about marathons a lot. It's the reason some people run marathons. It's a huge accomplishment. It's the endorphins. They feel every part of the marathon and they want to feel that. And it's a preference.
Yeah. Another comment we get a ton at my mom is, you don't get a reward. There's no reward for giving birth unmedicated. It's just like you said, there's a lot of physical accomplishments that people have that they don't get rewards for, and they still choose to do it. And I don't think we should be shaming a woman who says, I want to experience that. I want to feel it. I want the badass reward, whatever, I know there's not actual reward, but they feel it. They feel like, I did it. I gave unmedicated birth. And if that's how you feel, there's nothing wrong with that. And you're perfectly welcome to feel that way.
So one thing about epidurals is they interfere with the natural hormones. And so there is a very old film called The Elk and the Epidural. And what they found is that when animals had epidurals, they will refuse their young. They won't bond and connect because there is a massive surge of oxytocin that happens when a baby is born. And the epidural interferes with that. So other mammals just will reject their young if they're born by C-section or with epidurals.
Because they depend on the hormonal
exactly
bonding.
that hormonal exchange. But being humans and being able to think and rationalize the way we do and stuff, we accept our babies because we know they're ours. But there is that hormonal bond that it's a separate thing that does have it is interfered with. So another advantage of not getting an epidural is the faster recovery. So I remember with my first baby, because once again, even though the epidural didn't take the pain away, I still had the epidural for probably about 8 hours. And they kept putting the medication in me, even though it wasn't going where it was supposed to. What we just won't talk about that hospital, okay? Anyway, or that anesthesiologist. But all the effects of it, the negative effects, were there with this epidural. And I remember going home 2 days later and feeling like I'd been hit by a train. Like I just thought, it's been 46 hours since I gave birth, and my body just felt depleted, absolutely depleted. My second baby, having had the epidural for 20 minutes, I guess, total was all. And it never, not getting all that medication. I remember telling the nurse, I have to go to the bathroom. This is after I gave birth. And she said, okay, I'm going to go grab another nurse so that we can get you to the couch. We can strip your bed, change your bed, get you to the bathroom, and you'll come back to a clean bed. And so she went to get the other nurse, and she was taking a long time. I had to pee because remember, they give you that liter of fluid. I thought, well, I've just, I gave birth 16 months ago. I've already been there, done that. I got up, went to the bathroom, used my peri bottle, did my whole thing, came back and sat on the couch. And so she came in, she's like, oh, you moved to the couch. Let's get you to the bathroom. I was like, oh yeah, I've already been. She was like, what? So then they're stripping my bed and making my bed and, talking and everything. I was hungry. I was really hungry. And so I knew there was a snack room down the hall. So I got up and started walking down the hall by myself. I felt great. This is probably an hour after I gave birth.
Yeah.
And all of a sudden the nurses realized I was gone. They went down the hall looking for me, and they were like, you can't walk down the hall by yourself. And it was like, I feel so good, like so much difference than with that epidural that had been hours. And then with my third and fourth baby, it was the same thing. I was like, I could walk, I could move, I could, I mean, I was a little sore because, you've just given birth, right? But the difference in how my body felt was huge.
Yep. I can attest to the same thing. And actually, that one epidural I got that was only in for, 15, 20 minutes at the most. I actually did have really bad back pain.
Oh, did you?
With that. And I did have a bit of a slow recovery. But my other births that were just totally natural and great. I mean, I gave birth in the birth center for my last 5. And as soon as you guys had the baby weighed and all the stuff you have to do, all the paperwork and everything, I was like, can I go? I'm hungry. Yeah. And just put the jeans back on, the maternity ones, put your clothes back on and walk on out. Hubby carries the baby, of course, but it's like, I think if someone would have seen me and I said, oh, I gave birth an hour ago, they would have just been in utter shock because I looked and felt perfectly fine. And my recovery, moving on was, and a lot of women say that they had an epidural with their first baby, their second baby, they didn't, but it wasn't on purpose. It was just because of they couldn't get to the hospital in time or something. And then they saw how much better their recovery was, that was a huge deciding factor in them not wanting an epidural the next time. They're like, oh, that was way easier. Yeah. And I don't know if that's everybody's experience, but it's definitely something to take into consideration, because labor, when you're in the throes of it, it feels like it lasts a long time, but it's only, less than 24 hours usually. It could go longer every now and again, but then your recovery is actually a lot longer. So it's kind of like the pros and cons of course, recovery is, I mean, you can be lying around and resting and everything. I'm not saying that that's like going to be a number one determining factor for everyone, but it is something to take into consideration. And some women feel that is a really big factor. So
I have a fair amount of moms because of course at the birth center, we don't offer epidurals. And so they'll say, having had hospital births with an epidural before, or first time moms whose friends had them, they'll say, do I need a stool softener? I'm supposed to have a stool softener. And I'm like, you don't need a stool softener here. And they're like, why did I need one before? Or why did my friend need one, or my sister? And I say, because they have narcotics. The epidural has narcotics in it. Narcotics cause constipation. You didn't have any narcotics, you're not going to have an issue with constipation. And they're like, oh my gosh, really? And I'm like, yeah, it was the epidural that caused your constipation.
There's a lot of smaller things you might not think about. We hope that this has helped you kind of understand some pros and cons, some of the risks, reasons that generally women don't get an epidural. We'd love to hear from you in the comments. If you are planning on not getting an epidural, why not? Or if you've chosen in the past not to get an epidural. And again, I know we've mentioned this, but I just want to point out that choosing to get an epidural does not mean that you're choosing endless pain and suffering. I think that's what most women assume. That is for sure what I assumed, because my first births without epidurals were so horrible. And so I was just like, oh, it's either an epidural or excruciating pain, and those are the two options that you have. And that's what I used to very firmly believe. But now, because of the practically pain-free birth method, I understand that you can have low pain, what we call practically pain-free births, without the epidural. And that's what I was able to do after I learned this method. And so many other women have done the same. So don't forget to check out our free birth class, How to Give Birth with Practically No Pain. That's a really nice intro to this method, and you learn one of the most effective techniques for managing the pain of contractions. And then, of course, we've got a lot of other content on our YouTube channel that you can continue educating yourselves and preparing for this upcoming birth.